Have you ever looked at your palms and wondered if they might be telling you something about your liver? There are four specific warning signs that show up on your hands when your liver gets clogged with fat, and doctors have been using them for decades to catch liver problems early. Each sign has a clear biological explanation, so you will know exactly what is happening inside your body. I will walk you through all four, and if your liver needs some support, I will also share a natural protocol that may help. Sign number 1. Palmar erythema. Let me start with the most obvious one. Palmar erythema is when the palms turn red, specifically on the fleshy parts near your thumb and your pinky. Doctors call it liver palms, and they recognize it as one of the most common visible signs of chronic liver disease. The reason this happens comes down to hormones. Your liver is responsible for metabolizing estrogen, and when it becomes overwhelmed with fat, it cannot process estrogen properly. The excess estrogen then causes the capillaries in your hands to dilate, creating that reddish appearance you see. It is a visible effect of a hidden process. To check for this, compare both of your palms side by side. If you notice that the color is more intense on the thenar and hypothenar eminences, those are the fleshy pads at the base of your thumb and your smallest finger. That is a classic presentation of palmar erythema. The redness tends to be symmetric, showing up on both hands in the same spots. Some people also notice that the color gets warmer when pressure is applied, or after consuming alcohol. And those are additional cues that this might be more than just natural skin variation. Sign number 2. Dupuytren's contracture. Here is a sign that is much easier to miss, and this one shows up on your fingers rather than your palms. Dupuytren's contracture happens when the tissue beneath the skin on your palm thickens and tightens, which causes one or more fingers to curl inward toward your palm. It most commonly affects the ring finger and the pinky, and you might not even notice it starting until the bend becomes obvious. Medical researchers discovered decades ago that this condition shows up at much higher rates in people with chronic liver disease. One study in the Journal of the American Medical Association found that roughly 25 to 28% of patients with liver disease also had Dupuytren's contracture. The connection works through metabolism. When the liver is struggling, it triggers changes throughout the body that affect how fibroblasts grow, and those are the cells that build tissue in your hands. This one does not exclusively point to liver problems. Dupuytren's is also associated with diabetes, with epilepsy, and with heavy alcohol use. So, while it is a legitimate liver warning sign, it is not a standalone diagnosis. What matters is whether you have it alongside other signs on this list. If you notice your fingers bending inward, especially if it runs in your family, or you have other reasons to be concerned about your liver, that is worth bringing up with your doctor. Sign number 3. Terry's nails. Here is one that most people would never connect to their liver. Terry's nails is a condition where nearly the entire nail turns white or pale, with only a narrow band of pink color remaining at the tip. A doctor named Richard Terry first described this pattern in a 1954 paper in The Lancet, and it has been a recognized clinical sign ever since. The mechanism involves a protein called albumin. Your liver produces albumin, which is one of its hundreds of essential functions. When the liver becomes fatty and starts to fail, it makes less albumin, and that changes the vascularity of the nail bed. The nail loses its pink color because the blood vessels underneath are not receiving the same nutrients and signals from the liver. The result is that whitened, almost translucent appearance that doctors call Terry's nails. This sign is strongly associated with cirrhosis and liver failure, but it can also show up with kidney disease, diabetes, heart failure, and hyperthyroidism. Cleveland Clinic confirms that people with liver failure often have Terry's nails, and that makes it a useful flag, even though it is not liver-specific. If you push on your nail and it stays white instead of turning pink and then returning to normal, that is a characteristic finding. Like the other signs on this list, it becomes more meaningful when you see more than one of them together. Sign number 4. Asterixis. The fourth sign is the most dramatic and the most serious. Asterixis is a type of involuntary twitching that happens when you hold your arms out and bend your wrists backward, as if you were signaling stop. The hands start to flap or flutter in and out, and that motion is called a flapping tremor. Doctors first described this sign in 1949 in patients with severe liver failure, and it has been a standard part of liver assessments ever since. The biological explanation involves ammonia. Your liver filters ammonia from your blood, and ammonia is a natural byproduct of digestion that your body needs to remove. When the liver is too clogged with fat to do its job properly, ammonia builds up in the bloodstream and eventually reaches the brain. That ammonia interferes with the nerve signals that control muscle tone, and the result is those brief lapses where your muscles suddenly relax and create the flapping motion. When Asterixis shows up, it indicates that liver function has declined to the point where brain function is being affected. This is a sign of hepatic encephalopathy, which is a serious condition that requires medical attention. If you ask someone to extend their arms and dorsiflex their wrists, and you see that flapping tremor appear within a few seconds, that is a clear signal to seek medical evaluation. This one is not subtle, and it is not something to handle on your own. If you are finding this useful so far, hit that subscribe button and join the channel. There is a natural protocol coming up next that you will not want to miss, and new videos come out regularly for people who want to take a proactive approach to their health. All right, so now you know the 4 warning signs, and here is where it gets practical. Let me walk you through what you can do naturally to support your liver if any of this applies to you. These are the same approaches that research suggests can make a real difference for people dealing with fatty liver disease. The most researched natural option is milk thistle. Milk thistle contains a compound called silymarin, which has been studied extensively for its potential to protect liver cells from damage and support the liver's natural detoxification processes. The research is not definitive enough to call it a cure, but multiple studies suggest it can help reduce liver enzymes and may assist in protecting against further damage. If you decide to try it, look for a standardized extract and discuss it with your healthcare provider, especially if you are on any medications. Coffee is another evidence-supported option. Research consistently shows that people who drink 2 to 3 cups of coffee per day have lower rates of liver fibrosis and better liver function overall. The compounds in coffee appear to have anti-inflammatory effects on the liver, and the association holds even after researchers account for other lifestyle factors. This does not mean loading up on sugary coffee drinks will help. Plain black coffee or coffee with minimal added ingredients is what the studies support. Turmeric contains curcumin, which is a powerful anti-inflammatory compound. Some studies suggest that curcumin may help reduce liver inflammation and could be beneficial for people with this condition. The challenge with curcumin is that your body absorbs it poorly on its own, so look for formulations that include black pepper extract or piperine, which dramatically increases absorption. Here is the part that most people overlook, though. Supplements only get you so far. The real leverage is in your daily habits. Beyond specific supplements, the lifestyle foundation matters more than anything else. Losing 5 to 10% of your body weight can measurably reduce the fat stored in your liver. Regular exercise, even if it is just walking, helps your body metabolize the excess energy that would otherwise become liver fat. The Mediterranean diet, which emphasizes vegetables, whole grains, healthy fats, and lean proteins, has been shown in multiple studies to improve liver health markers. Avoiding alcohol entirely gives your liver the best chance to recover. And controlling your blood sugar and cholesterol levels addresses the metabolic drivers that got the fatty liver started in the first place. Your palms can tell you a story about your liver that blood tests might not reveal until things get more serious. Watch for redness that stays on the fleshy pads, fingers that bend toward your palm, nails that turn white from base to tip, and any flapping tremor when you hold your arms out. If any of those apply to you, that is a reason to pay attention and take action. The natural protocol we covered here gives you a starting point, but working with your healthcare provider is the most important step you can take. If you want more content like this, subscribe, and I will see you in the next video.